Greetings, dear learners. Before beginning our topic, I shall be sharing with you certain clinical case scenario based questions. We will be discussing them at the end of the topic. However, by the questions, you have to guess what topic we are going to study today. So let's begin. Question 1 is a 18-year-old college freshman began drinking alcohol at 8:30 p.m. during a hazing event at his new fraternity. Between 8:30 and approximately midnight, he and the several other places consumed beer and alcohol of whiskey, and then he consumed most of the bottle of the rum at the urging of the upperclassmen. The young man complained of the feeling nauseated, lay down on the couch and began to lose consciousness. Two upperclassmen carried him to his bedroom, placed him on his stomach, and positioned a trace can nearby. Approximately 10 minutes later, the freshman was found unconscious and covered with vomit. There was a delay in the treatment because the upperclassmen called the college police instead of calling the 911. After the call was transferred to the 911, emergency medical technicians responded quickly and discovered that the young man was not breathing and that he had choked on his vomit. He was rushed to the hospital and where he remained in coma for the 2 days before ultimately being pronounced dead. The patient's blood alcohol concentration shortly after arriving at the hospital was 510 milligram per deciliter. So the questions are, what was the cause of death in the patient's death? If he had received medical care sooner, what treatment might have prevented his death? Then the next question is, Mr. Sankar Rai, a 35-year-old married man, factory worker, was brought to the emergency department of the hospital by his family members because he had vomiting, tremors of the hands and tongue, sweating, and seemed wild-eyed and confused. He ate and slept very little. He was shouting that the insects were crawling on his body. In the emergency department, his pulse was recorded as 120 per minute, BP was 170 by 90 mm of Hg, respiratory rate was 36 per minute, and temperature was 100 degree Fahrenheit. He also began to have grand mal seizures. After collecting the history from the family, it was revealed that the patient customarily drank at least a bottle of liquor every day. He had been drinking it for last 10 years, but he ran out of the money and liquor about 3 days ago as he was recently sacked from the job. Based on the symptoms and the history, the patient's diagnosis is. So, the options are Wernicke's encephalopathy, the Korsakoff psychosis, delirium tremens, cannabis intoxication. Then the next question is, a 33-year-old man with a fever was admitted in an altered mental status for 2 days. The patient had the medical history of hypertension and was compliant with his medications. As per the patient's family, the patient drinks alcohol socially since more than 10 years and has not had any such episodes of confusion before. The patient's family denied any history of chills, fever at home. His vitals in the emergency department were 14 breaths per minute. Blood pressure was 130 by 80 mm of Hg. Temperature was 101.5 degree Fahrenheit. Heart rate were 136 per minute. The patient was acutely agitated in the emergency department. Physical examination showed that the patient was alert but not oriented to time, place, and person. Neurological examination showed no motor and sensory deficit. The patient had the gaze palsy with direction changing nystagmus. Pupil examination were unremarkable. Examination of other systems revealed no abnormalities. On MRI of the brain, they were showing the hyperintensities in the medial thalamus region and the inferior colliculus and the periaqueductal region demarcated by arrow, as you can see in the pictures. So the now question is, what is your most likely diagnosis? Is it bacterial meningitis? Is it Wernicke's encephalopathy? It is cause of cough psychosis, or it is herpetic encephalitis. By now, you would have understood that our topic of learning for today is alcohol. Another case-based question I would like to put before you. A 30-year-old drowsy male was brought to the casualty. His pulse was 130 per minute, respiratory rate was 30 per minute. His lab reports were arterial blood gas analysis showed metabolic acidosis. Total serum calcium was 6.8 mg per deciliter. Blood urea was 100 mg per deciliter. Creatinine were 3.5 mg per deciliter. And on urine analysis, calcium oxalate crystals were present. He showed improvement on the nasogastric aspiration and administration of sodium bicarb, calcium gluconate, and the 4-methyl pyrazole. So the now question is, what substance did he most likely consumed? Whether it is formaldehyde, ethylene glycol, paraldehyde, or methyl alcohol. We will come to the answer of all these questions and discuss how to come to the conclusion after end of the topic. So we will begin our understanding on the alcohol. Alcohol is included under the substance abuse, under the CNS depression, and as inebriant poison. Under the substance abuse, WHO defines the substance abuse that is the harmful or hazardous use of the psychoactive substances including alcohol and illicit drugs. Alcohol is a socially acceptable drug. It is the third most common drugs of abuse after caffeine and nicotine. CNS depression, under that the ethyl alcohol, general anesthetics, opioid analgesics, sedative hypnotics that includes the barbiturate, benzodiazepines and non-barbiturates. We already saw this classification when we were classifying all the poisons. Then under the inebriant poisons, alcohol is also included. Inebriant poisons are those poisons that produce intoxication, that is lightheadedness, confusion, disorientation and drowsiness, like alcohol, barbiturates, chlorhydrates, benzodiazepines, paraldehyde, anesthetics, hydrocarbons, formaldehyde and the many pesticides. They all are inebriants. Then alcohol are actually the hydroxy derivatives of the aliphatic hydrocarbons. There are three categories of alcohol. Monohydroxy alcohol contains one hydroxyl group. Ethanol, methanol, isopropanol are the examples. Then the dihydroxy alcohols that contains the two hydroxyl groups, ethylene glycol, propylene glycols. Trihydroxy alcohol, they are not really alcohol but they are derivatives of the monohydroxy or dihydroxy alcohols that includes the glycerol, glycerine. Then another term related to the alcohol that is often used with respect to the alcohol is the toxic alcohol. The term toxic alcohol traditionally refers to the alcohol other than the ethanol that are not intended for ingestion. However, this categorization might seem arbitrary considering that all alcohol possesses the toxic properties including inebriation and potential organ damage when consumed excessively. The most common clinically relevant toxic alcohol are the methanol and the ethylene glycol. We will be learning them along with the ethyl alcohol. So, starting with the ethyl alcohol, also called ethanol, C2H5OH is its formula. It can be represented in the C2H6O or CH3CH2O. Ethyl alcohol is a clear, colorless liquid with a faint fruity odor and the sweetest burning taste. It is both water and the lipid soluble. Common forms of alcohol are absolute alcohol. This is essentially 100% ethanol and is commonly used in various applications. During its production, azeotropic distillation, which involves the use of benzene, is used to remove the water. Rectified spirit, also known as neutral spirit or the rectified alcohol. This type of alcohol contains the 95% of ethyl alcohol. It is produced through the repeated distillation or rectification until the alcohol concentration reaches 95%. At this point, it forms a azeotrope. Benzene is then added to make it absolute alcohol. Rectified spirit finds its use in the mixed drinks, liquor production, medicinal purposes, and as a household solvents. Then the methylated spirit or the denatured alcohol. This type consists of 90% ethanol, 9.5% methanol, and the 0.5% crude pyridine. Denaturants like methanol and pyridine make it unfit for consumption due to their poisonous nature or the foul taste. Other denaturants include the butyl alcohol, gasoline, and the kerosene. Methylated spirit is intended for use as a solvent or the fuel and is denatured to avoid excise duty levied on the drinkable alcohols. The standard drink is not a form of alcohol, but it is the for the drinking purposes what is considered the standard drink or one peg we talk in the lay language is the standard drink. It contains the 10 gram of the absolute alcohol equivalent to 1 unit. So, one peg is said to contain the 10 gram of the absolute alcohol, then it is the standard drink. That is, suppose a drink is having 33% concentration of the alcohol, then its 30 ml is the one peg or the one standard drink of that type of alcohol. This is the concept behind the standard drink. Then the alcohol is available in different brands, flavors and different varieties according to the concentration. Characteristic flavors of the alcoholic beverages are due to the organic compounds called as the congeners such as the propyl alcohol, octyl alcohol, glycerine, aldehydes, dimethyl and diethyl esters, acids, ketones, trimethylamine, allyl mercaptans, diethyl sulfide, pyridinone. All these are added to the alcohol to add to its taste and make it tasty and having the good odor. Ethanol content of various alcoholic beverages is expressed by volume percent or by proof. As you can see here in the table, the different beverages has different ethanol content that is expressed by percentage by the volume. Light beer that contains the 4 to 6% of the ethanol. Heavy beer contains the 6 to 12% of ethanol. Natural wine has 2 to 8% of the alcohol. Then the fortified wine had 10 to 20% of ethanol. Whiskey, gin, tequila, brandy, they have the 40 to 45% of ethanol. Rum contains the 40 to 60% of ethanol. And the vodka that contains the 60 to 65% of ethanol. That is, maximum contents are seen in the rum and the vodka that belongs up to the 60%. Then regarding the proof spirit, that is also a way to express the concentration of ethanol. There are the various definitions of the proof spirit. One of the definitions says that proof spirit is one which at 10.5 degrees Celsius weighs exactly 12 by 13 parts and equal to measure of the distilled water. In that, the definition, some definitions consider 100% proof as the 50% ethanol, and around that, the idea of development of proof spirit is very interesting. It is that the minimum concentration of ethanol, which when mixed with the gunpowder would ignite, that is about the 57.06%. Spirits weaker than 57.06% were the underproof, and the stronger proof are those that have the ethanol concentration more than 57.06. The story behind the proof spirit is that in the early days, sailors in the British Navy suspected that the officers were diluting their ration of rum and demanded proof of its purity. Then it was a tricky task to prove that the content in the rum was appropriate or not. For this, they mixed the rum with the gunpowder and tried to ignite it. If rum would be highly diluted with the water, gunpowder would not ignite. If it is ignited, it means that the rum was at the least having the 57.06% of the ethanol or above. Thus, the purity of the alcohol was proved, and hence the concept of proof spirit got developed. Alcohol is used for various purposes in our day-to-day life. Alcohol beverages like beer, wine, whiskey, gin, brandy, rum, and vodka are the popular choices. Additionally, different regions boast unique concoctions such as the arak, toddy, and feni in India, tequila in the Mexico, sake in the France, eau de vie or the fruit brandy in the France. Alcohol functions as a solvent in aftershaves, colognes, and the perfumes with alcohol content varying between 15 to 18%. It is used for medicinal purposes. Various antihistaminics, decongestants, multivitamins, cough syrups contain the alcohol ranging between 2 to 25%. Mouthwash formulation may contain the alcohol up to 75%. Ethanol is historically known as antiseptic. Surgical spirit primarily comprises ethanol in concentration of 90 to 95% with a small amount of methanol, that is around 5 to 10%, along with the traces of other substances. Nowadays, methanol's use is declining and isopropanol is often used in surgical hand rubs that contains around 70% of the isopropanol. Ethanol sponging is effective for treating the hypothermia. Dehydrated alcohol injections near nerves or the sympathetic ganglia are used to alleviate long-standing pains such as trigeminal neuralgia pains. The small doses of ethanol may help reduce common cold symptoms. Then ethanol may serve as an antidote for the methanol poisoning and ethylene glycol poisoning that we will be coming when we will be talking on the methanol and the ethylene glycol. Rectified spirit around 90 to 95% ethanol acts as a preservative for viscera and the chemical analysis. This is considered to be the best preservative for the viscera for the toxicological analysis purpose. Ethanol is utilized as a fuel. Ethanol is used to extract nucleic acid from the tissues or tissue culture in various biotechnological processes in different laboratories. These are the different day-to-day uses of the ethyl alcohol. Ethanol is rapidly absorbed from the stomach. It is absorbed in the concentration of 20% from the stomach, and the small intestine that has the major absorption, that is the 80% upon the oral ingestion. Peak blood alcohol concentration occurs within 30 to 90 minutes after the ingestion of the alcohol. Factors affecting the absorption of the alcohol include undiluted ethanol, food presence, delayed gastric emptying, and the alcohol congeners. Inhalation of the vaporized ethanol can lead to the rapid intoxication. Women achieve higher blood alcohol level than the men due to the reduced gastric alcohol dehydrogenase activity. So there are multiple factors that increases the absorption of alcohol and the factors that decreases the alcohol absorption from the stomach and the small intestine. We will be talking some of the important factors that increase the alcohol absorption and that decrease the alcohol absorption. The factors that increase the alcohol absorption is when the concentration of alcohol is between 10 to 20%. So the moderate drinking is the good for the increased absorption of the alcohol, whereas the alcohol concentration below 10% or above 20% is reason for the decreased absorption of the alcohol. When the concentration of alcohol is more than 40%, then the absorption is very slow because of the pyrolic spasm, secretion of mucus due to the gastric irritation, reduced gastric motility. When the alcohol is swallowed rapidly and in large volumes, then also the alcohol is absorbed more. Whereas when alcohol is slowly gulped, in that case absorption is slower. When alcohol is taken in empty stomach, then alcohol absorption is increased. When alcohol is taken with the carbonated drinks like soda, cold drinks, bubbles greatly increase the surface area carrying the alcohol, so it causes increased absorption. When the drink is warm, that causes the gastric capillaries dilatation. In case of habitual drinkers, in patients of gastrectomy, when the simultaneous ingestion of the parasympathomimetic drugs like prostaglandin, drugs that increase the gastric motility like insulin, all this increases the alcohol absorption. Then the inhibition of the sympathetic tone like stress and anxiety may have the unpredictable effect on the alcohol absorption. Another factor for increased alcohol absorption is the drinking before noon. That is also seen to be increased alcohol absorption, probably due to the vasodilation. Then other factors that decrease the absorption of alcohol are the when it is taken with food, especially rich in fat, proteins, gastric emptying, it is delayed, spicy food, and that causes irritated mucosa. All these results in the decreased absorption of the alcohol. When drink is ice cold, that also causes decreased absorption of the alcohol. In cases of the new person who has started drinking, there also the absorption is less. With simultaneous ingestion of the parasympathomimetic drugs like atropine or with the sympathomimetic drugs like adrenaline and benzedrine, this causes the decreased absorption. All the drugs which decrease the gastric motility, achlorhydria and the chronic gastritis, decreased vagal tone like nausea, anxiety. Cigarettes also cause the slowed gastric emptying. These are the various conditions when the absorption of alcohol is increased or decreased. That is important to know, especially for those who are consuming the alcohol. It may improve their way of the intake of alcohol by this knowledge. It may improve their way of intake by this knowledge, so they may avoid the unwanted complications with respect to the alcohol intake. Then under the toxicokinetics, coming to the metabolism of the alcohol, more than 90% of the ingested alcohol undergoes metabolism in the body. Metabolism primarily occurs in the liver through three pathways. One is the alcohol dehydrogenase pathway. It occurs in the cell cytosol. Then another is the microsomal ethanol oxidizing system, that is MEOS COIP2E1 system located on the endoplasmic reticulum. Then another system for the metabolism of alcohol is the peroxidase catalase system in the hepatic peroxisomes. So the ethanol that is consumed get converted into the acetaldehyde with the help of the alcohol dehydrogenase. The same is being done by the microsomal ethanol oxidizing system and the catalase peroxidase system that cause the metabolism of the alcohol to acetaldehyde, and that is further converted to the acetate and utilized in the Krebs cycles. In this way, the metabolism of the alcohol is done. MEOS system becomes the significant in the chronic ethanol use, affecting the drug interaction and possibly potentiating the paracetamol hepatotoxicity. Usually, the measure of the alcohol is metabolized through the alcohol dehydrogenase pathway. However, in the chronic alcoholics, this microsomal ethanol oxidizing system becomes more activated, that is located on the endoplasmic reticulum. This MEOS system becomes significant in the chronic alcoholic use, affecting drug interaction. This enzyme activity and the CYP2E1 becomes the more activated. So it is more involved in the metabolism of the alcohol rather than the metabolism of the drugs, that results in the drug toxicity more and the drug interaction with respect to the alcohol consumption, and that may potentiate the paracetamol hepatotoxicity as well. So in this way, chronic alcoholics are more susceptible to the drug interaction and the drug toxicity. Then regarding the excretion of the ethyl alcohol, only 5 to 10% of the ingested ethanol is excreted unchanged by the kidney, lungs and the sweat. Lung excretion follows the Henry law, that is the ratio between the concentration of ethanol in alveolar air and the blood is constant, allowing estimation of the blood alcohol concentration through the breath analyzer. That is the concentration in the lungs and the blood is almost equal. So the breath analyzer gives the approximately correct value of the blood alcohol concentration. Then the kinetics and the variation with respect to the ethyl alcohol. Ethanol metabolism initially follows first order kinetics and later on it becomes the zero order kinetics once the alcohol dehydrogenase is saturated. Adults metabolize ethanol at the rate ranging from the 100 to 125 mg per kg per hour for occasional drinkers and up to the 175 mg per kg per hour for the habitual drinkers. Ethanol clearance rate varies among individuals, like the Asians possibly harboring an inactive aldehyde dehydrogenase variant leading to severe flushing reactions. Liver damage can occur in women after consuming a smaller alcohol quantities compared to the men. Ethanol metabolism may shift to zero order kinetics in case of the chronic drinkers. Tolerant drinkers exhibit higher ethanol clearance rate. Individuals with inactive aldehyde dehydrogenate variants may experience severe flushing reactions even with a small ethanol concentrations. So, in this way, various factors affect the alcohol metabolism and various types of the variations are observed in different individuals with respect to the ethyl alcohol consumption. Then the mechanism by which the alcohol acts on the body, particularly the central nervous system. Basically, it is the evolving theory related to the action of the ethyl alcohol on the central nervous system. According to traditional theory, ethanol was initially thought to depress the central nervous system by dissolving the cell lipid membranes, causing disorganization, membrane fluidization. However, recent studies suggest that this occurs only at very high ethanol concentration beyond the pharmacological range. Current theories are that enhanced GABAergic function, ethanol may enhance the gamma aminobutyric acid GABAergic function by interacting with the GABA A receptors and associated chloride ion channels. Then another way of its action is involvement of the NMDA glutamate receptors. The second theory implicates N-methyl D-aspartate, that is NMDA ligand-gated glutamate receptors. NMDA receptors regulate neuronal long-term potentiation and mediate the neurotoxicity by increasing calcium permeability. Acute ethanol use inhibits the NMDA receptor functions, while the chronic use leads to upregulation of the NMDA receptors. So, by this mechanism, it is said that initially it stimulates the brain and then depresses the brain. Then the different pharmacological actions are observed on different parts of the body. Like the central nervous system, it initially stimulates the central nervous system, then depresses, leading to the impaired memory, concentration and the mood swings. Severe intoxication, it causes the CNS impairment, potential coma. It causes disruption in the sleep patterns. Then on the cardiovascular system, on the moderate doses, it causes tachycardia, vasodilation and the warm skin. However, it doesn't increase the coronary blood flow. Moderate drinking of alcohol is linked with the reduced coronary heart disease risk. So often the books have recommended moderate drinking of alcohol is beneficial, particularly for the heart of the person. Then on the gastrointestinal system, it initially stimulates the salivary and the gastric secretions. Later on high concentration, it inhibits the gastric secretion, leading to the inflammation. On chronic intake, it causes the gastritis, pancreatitis, liver cirrhosis with excessive intake. On genitourinary system, it causes the increased urination by inhibiting the antidiuretic hormones. Effect of alcohol on the sexual function, it is said that alcohol increases the sexual desire but it reduces the sexual responsiveness. On chronically, it causes impotence, sterility, hormonal imbalance and increased risk of the breast cancers. We can summarize the effect of the alcohol on the long term by this photograph. Here the different organs respond differently to the effect of the alcohol. Like this pink color indicates that the bad effects of the alcohol on the different systems of the body, whereas the green color indicates the good effect of the alcohol on the different systems of the body. On the large consumption, on the brain, it causes the impaired development, Wernicke-Korsakoff syndrome, vision changes, ataxia, impaired memory, psychologically, craving, irritability, antisocial behavior, depression, anxiety, panic, psychosis, hallucination, delusions, sleep disorders are increased. Mouth and trachea and esophagus may develop cancers. Blood may show anemia. On heart, it causes alcohol cardiomyopathy. On liver, it causes hepatitis and the cirrhosis. On stomach, it causes chronic gastritis. Pancreas, it causes pancreatitis. Peripheral tissue, it increases the risk of the type 2 diabetes mellitus. In this way, it causes the bad effects on the body. Whereas the certain good effect of the alcohol on the body are that in general, it increases the insulin sensitivity and lowers the risk of the diabetes. On brain, it reduces the number of the silent infarcts. On blood, it causes increased level of the HDL cholesterol. It decreases thrombosis. It reduces fibrinogen. It increases fibrinolysis. All the beneficial for the risk of the coronary heart disease. It also reduces the arterial spasm from the stress. It increases the coronary blood flow. On the skeletal system, it increases the bone mineral density. On the joints, it reduces the risk of rheumatoid arthritis. On the gallbladder, it reduces risk of developing gallstones. On the renal system, it reduces the risk of developing the renal stones. In this way, it has many of the beneficial effects on the body. And the signs of intoxication clinically, in case of alcohol poisoning, presents in two forms, acute and chronic. However, these are more often referred to as alcohol intoxication in case of acute poisoning, whereas the alcohol addiction in case of chronic poisoning. Coming to the acute poisoning with respect to the ethyl alcohol, that may be said as the alcohol intoxication. Effect of the alcohol on the body depends upon the blood alcohol concentration. So, effect of alcohol on the body is divided into the 7 stages. On the blood alcohol concentration of 0 to 50 milligram per 100 ml, the patient is in the sobriety state. This is called a stage of sobriety. Patient shows near normal behavior. At the concentration of 50 to 100 milligram per 100 ml of the blood alcohol concentration, this is a stage of euphoria where patient has the feeling of well-being, sociability, talkativeness, increased confidence, decreased inhibition, fine movements are affected. At the concentration of 100 to 150 milligram per 100 ml, the stage of excitement, that is emotional instability, impairment of memory and comprehension, increased reaction time and the mild ataxia. Blood alcohol concentration of 150 to 200 is a stage of confusion. The patient is disoriented, confused, vertigo, diplopia, ataxia, slurred speech, and the staggering gaits are present. At the blood alcohol concentration of 200 to 300, it is a stage of stupor, general inertia, diminished response to stimuli, inability to stand or walk, vomiting is presented. At the concentration of 300 to 500 milligram per 100 ml, the stage of coma, the patient goes unconscious, abolished reflexes, subnormal temperature, incontinence of urine and feces, respiratory compromise happens. At the concentration of more than 500 milligram per 100 ml, the patient is a stage of death. Patient dies mostly due to the respiratory failure. In this way, the 7-stage classification of the blood alcohol intoxication is studied. The 7 stages can be remembered as a series of 7 Ds, that is, a stage of sobriety as descent, delighted, euphoria, delirious is excitement, dazed, the confusion, dejected, stupor state, then the dead drink, that is comatose state, and the death. So 7D you can remember for these 7 stages. Rarely, ethanol consumption may trigger allergic responses like urticaria, nasal congestion, or headache, sometimes leading to severe outcomes. Binge drinking episodes are associated with cardiac arrhythmias, including atrial fibrillation, posing significant health risk. Following consumption, individual emits a distinct odor from his breath, attributed to the non-alcoholic constituents in the beverages, persisting even after its sobriety stage. Pupillary effect and the Mc Ewans sign are seen on the eyes. Initially, ethanol causes the dilatation of the pupil, that is mydriasis, potentially followed by the constriction during the terminal stages, known as the Mc Ewans sign. Also, ethanol intoxication induces physiological alterations like hypothermia, hypotension, tachycardia, and respiratory irregularities. Metabolic disturbances, including lactic and ketoacidosis, may lead to hypoglycemia and related complications. Often, stage 3 and stage 4, that is the stage of excitement and the confusion, in the case of ethanol intoxication, are crucial regarding the offense commission, with recovery often accompanied by the hangover symptoms are presented in those patients, and often the crimes are committed in the stage 3 and stage 4 state under the influence of the alcohol. Mc Ewans sign, that as we talked in the alcohol intoxication, also known as the tonic pupil or the Eddy's pupil. Pupils are dilated in the stage of the excitement, that is stage 3, and in case of coma, that is stage 6 of the alcoholic intoxication, pupils are constricted. At this stage of coma, if the certain stimuli like the pinching, slapping or the hair pulling are applied on the face of the person, the pupils are dilated. So, from the dilated state to the constricted state in the comatose condition, and again dilatation on the pinching or the slapping on the face, and they again slowly return to their normal constricted state after about 20 minutes, even though the patient doesn't regain the consciousness. This change, this reaction of constricted to the dilatation is called as the Mc Ewans sign, that is demonstrated on the comatose patients. This Mc Ewans sign is indicative that the coma in the patient is due to the alcohol intoxication, not due to the physical injury or the structural problem. If coma is due to the physical injury or the structural problems, then the mild stimuli doesn't cause the pupils to dilate. This Mc Ewans sign was named after the Sir William Mc Ewans, a pioneer in the neurology, who first observed and documented this type of pupil response in the alcoholic patients. So, this is the important sign to be listed to make the diagnosis of the alcoholic coma. This is all for today. We shall continue in the next class. Thank you.